Where We're From highlights the rich textures, histories, and experiences of the Asian, Pacific Islander, and Desi American community. Each episode is produced by students at San Jose State University.
Starting in March 2020, COVID-19 was spread worldwide and the world went into lockdown. Multiple companies had many layoffs and many smaller businesses had to shut down. The origin of the COVID-19 virus was traced to China, and some people believe that it was their fault for the pandemic that even started. That hatred and abuse transferred to Asian Americans, whom, even if they participated in the spread of the virus from China, did not deserve it. In the United States, Asian Americans are severely overrepresented in the healthcare industry. Even though Asian Americans make up for roughly 7% of the US population, about 9% of healthcare workers are Asian American. From pharmacists to volunteers and vaccine clinics, Asian Americans continue to show a heavy presence in the industry, which has its pros and cons. Throughout the pandemic, Asian Americans in healthcare were discriminated against heavily, undeserving of the harassment and abuse they received, and with very little recognition for their time and energy in return.
So welcome back to episode 2 of the Procrastinators Podcast. Today we're going to be talking about the frontline workers of COVID-19, the Asian American healthcare workers. And the theme of today's episode is current events after January 2018. I'm Josh Wolf.
I'm Trevor Dobler.
I'm Angelo Metabat.
And I'm Kevin Trent.
All right, so let's start out with the our first discussion question. How did COVID-19 affect Asian Americans in general? Well, in my research, I didn't find a specific stat that pertained to Asian American healthcare workers, but I did find something that was relevant to the topic, which was that the number of reported anti-Asian hate crimes increased, at least in California, by 107% in 2020 from 2019. And that's insane. And and the whole reason is because of COVID. And the other fact that I found was that Filipinos comprised 4% of registered nurses in the US, but they ended up making up 31.5% of all COVID-19 related facilities. So that means that they were more likely to be on the front line of the intensive care units and the vaccine clinics. And despite this, at least in general, 22% of Filipino Americans were working and were also struggling with poverty, which included the healthcare workers. And I think that's insane, right? Because they're supposed to be the backbone of America at this time, because they're the only thing that's stopping the COVID-19 from spreading around, you know.
Yeah, it's just crazy how they're on the front lines and they're the ones just still struggling so much. And even on top of that, they're just getting treated poorly, not even financially, but just with very little respect.
Yeah, I actually remember through my research, I was also seeing that indeed that they were all basically in ICU units, the most dangerous places you could be in the hospital, being the most exposed. And at the same time, they were short on a lot of the supplies that they were requesting so much. And which leads me to my research, which I was looking into the nursing associations of Asian Americans, and actually had got an insert from one of their presidents named Catherine Rubio. She was basically just talking about all the struggles they had, short on staff and supplies, and how most Filipino Americans were forced into working in these front lines, or not even forced, because a lot of Filipino Americans or Asian Americans in this case were okay to take on the challenge head on. They were super brave and okay with prioritizing these patients over their own families. And I just found it crazy that you're saying that they're getting all this hate and all this and they're dealing with all this poverty, yet they're still working this hard.
It seems to be the theme of no recognition, the lack of recognition again. That was very relevant in the first episode where we were talking about the railroad workers. And they should be getting a lot more recognition, but they're just not.
True.
Just felt like a lot of people just like were blinded by like their anger and just like refused to accept the fact that they're contributing a lot to help the country.
Kiwen, I think you were gonna say something.
Yeah, and I feel like the hate is directed towards the Asian Americans instead of like really think about who's like behind like the COVID and stuff. Think about what really causes the COVID.
Had nothing to do with them.
All right, and then so we went through how there were like violent crimes, right? Violent acts against them, such as like, assault and like just intimidation in general. And so that leads into our next question, which is how did they respond to this violence?
So in my research, they got up rally against like the violence that's like committed on Asian Americans. There was one person, Michelle Lee, was like a writer and resident physician in New York Presbyterian Cornell Hospital. And in March 2021, like the Sunday after like the shooting of like where like 8 people were killed and 6 of them were Asians. So she organized a rally in Manhattan's Columbus Park with like 100 healthcare professionals from across New York City to fight against the Asian hate in support of the Asian American and Pacific Islander community. So like during the rally, the physician and activist Kevin Song recruited the name of like the victims, connecting them to the death of Vincent Chen, who was also like what we know in class, also like killed from like Asian hate. And Michelle Lee expressed her solidarity with like the Asian American and Pacific Islander community, saying that she sees herself and the community and her community in the victim's place that was killed and will always remember them.
Yeah, I thought that was just like a really powerful rally. I also like researched the same rally, and I saw at it there was a physician who at the time she was still attending school. Her name was Natty Jamarangong. I probably butchered that last name, but she spoke out at the rally in front of the 1,000 people that showed up about her experiences of the abuse she faced, and she was telling about the time how she was just like walking home from class one time, and this white man came up and was calling her racial slurs, and then the man attacked her, and she said how like no one came to help her, and she was just there, and it was just I felt that it was really powerful how so many people came and listened to her, and she had 40 fellow healthcare workers on stage with her, and it just was like a very strong platform.
Actually, it seems pretty similar to the Vincent Chin death, actually, because
Yeah,
with Vincent Chin, right, there you have all these Asian American communities coming together, right? But this time it's all these different Asian American workers, right? So you have you have Asian American students, you have other Asian Americans in other industries coming together with these healthcare workers to help support them, right?
It was just gave them a thing to come together for and support each other.
Yeah, to add on like how they would respond to the violence, I found the perspective of a Filipino nurse named Michelle Gutierrez-Bo, and she talked about how like during COVID, a lot of her coworkers had to deal with a lot of verbal abuse and harassment because of like the racist actions going on. Some people would tell them to like not talk to them because they don't understand what they're saying, to tell them to speak English, even though they were speaking like fluent English. They would also say things like "go back to where you came from" or just insult them and call them stupid and dumb. And like Michelle Gutierrez-Bo like couldn't do anything because she has to be like professional, and like she would respond by like calling security and stuff, but like she had like nothing to like really protect them. All they can do is just wait and hope that they don't do anything crazy.
Yeah, I kind of find that crazy. Like these nurses are like being called these names and being harassed while working. Like I heard that they're called like disease carriers because
Yeah,
they're just Asian and stuff like that. And then they had things thrown at them. It's like I don't know, as a patient, like how could you do that to someone that's literally taking care of you? Like
Risking
they're
their
like,
life to help you.
yeah, they're saving your life and you're just hating on them, you're harassing them. It's like you're being racist, so ignorant.
We're just using them as a scapegoat for like the what happened in like the pandemic.
And the worst part was that the nurses couldn't do anything back to them because if they did, then they would get fired for not being professional. So they just let the patients do whatever they want.
It seems like this is also kind of similar to the nail salon thing, right? Where
Yeah.
a lot of the nail salon workers, it's not like they could really fend for themselves against any like harassment they get from any customers, right? And it's like at some point they have to be able to not like fight for themselves physically, right? But they have to be able to stand up for themselves, which it's kind of impossible, right? Because just throughout history, Asians have been seen as this like
Model
uh,
minority.
yeah, I guess that works. Yeah, they've always been seen as like the model minority, right? And like now it's like Asian Americans have to live up to it when in reality they really shouldn't. They really shouldn't have to.
Yeah, it's like being suppressed and thinking like, oh, you don't experience any racism, and then like even if you become a doctor and stuff, you still like experience all this violence against them.
Right. So now it's time for overall reflections about our discussion questions. Quick reminder: we discussed how COVID-19 affected Asian Americans in general, and we also talked about how Asian Americans responded to the violence that they got as a result of the COVID-19. And personally, I mean, honestly, at this point, it's kind of expected. I think that Asian Americans would just get this hate for no reason, right? Because like it's been the same thing throughout history, right? And it's about time that it should, in this day and age, it shouldn't be as big as it is, but it is, and it's sad. It should be changed.
It's good. It was good to see people come together and try to bring that change.
It makes me think if COVID-19 didn't like start in China and like it started in like, I don't know, like some European country or something, would they treat like the white people the same as they did the Asians?
Oh, for surely not. Like they could just pick at us and like, like use us as a scapegoat easily. But if that was the case for like Europeans, I doubt they would, attack them that much.
Which is quite sad, as it like a double standard.
Yes, for surely. Like how do I say this? But yeah, like overall, like these nurses and all these healthcare workers, even like after all the violence they received, it's like, yeah, sure, they responded to it through those rallies and strikes, but only that could do so much, right? Like in their actual workplace, and can't really change how people think, because some ignorant people, it's like talking to a wall, And so this goes back to the first episode that we did. I think it's like the lack of recognition and like remembering what they did, because after all this COVID stuff is done, like all the people that were mean and like racist to these Asian Americans, they won't even care about them after. Like they won't even acknowledge what they did, which is really dumb to me.
Yeah, I also find it really strange that like even though like the virus come from China, they just identify all Asians as like the problem source of like virus. It's so stupid.
It gets me mad, especially for me. My parents were both healthcare workers, and of course they don't want to share like all the details they do at work. But I'm sure that they also gotten some of this hate and like some of this harassment, or they just don't want to tell me. But I just kind of like enrages me, but there's only so much I could do as a student.
Yeah, we can only hope that over time, in like the next 10, 20 years, that the violence that the violence towards Asian Americans during 2020 to even today 2023 is still remembered, because the Vincent Chin stuff, it's not remembered, and it's pretty important, right? And the fact that that's not remembered is pretty scary, considering all the stuff that they did, and how little the U.S. justice system recognized racism. All right, so that was the end of episode 2 of the Procrastinators Podcast. For our next episode, we are going to be talking about popular culture, and the title of that next episode is Asian Americans Now Rule the Film Industry. And in that podcast, we'll be talking about the movie Everything Everywhere All at Once.
Thank you for listening to Where We're From. This podcast is produced by students enrolled in Dr. Joanne Rondilla's Asian American Studies courses at San Jose State University.